Long-term stress is one of the most serious, yet often underestimated factors that gradually destroys the human body. Unlike short-term tension, which can have a motivating effect, chronic stress has a negative impact on many biological systems and functions. Over time, it can lead to serious physical and mental disorders. In a moment, we will take a closer look at how stress affects the most important systems in our body, including the immune system and the mind. Heart and circulation. When we're stressed, hormone levels rise, especially cortisol and adrenaline. Adrenaline makes the heart beat faster and narrows blood vessels, allowing blood to flow quickly to the muscles. In the short term, this natural response boosts readiness for fight or flight. However, when our heart beats more strongly, for an extended period of time, it can cause feelings of palpitations, shortness of breath, and anxiety in some people. Additionally, chronic stress keeps blood pressure elevated, which increases the risk of developing hypertension and its complications. Furthermore, stress increases the level of so-called bad LDL cholesterol. LDL stands for low-density lipoprotein. These are particles that transport cholesterol in the blood. When there are too many of them, they begin to accumulate on the walls of blood vessels, forming atherosclerotic plaques. Over time, this can lead to the narrowing of the arteries and problems with blood flow, which increases the risk of a heart attack. Therefore, chronic stress can damage blood vessels and, as a result, lead to the development of atherosclerosis, coronary artery disease, and even heart attack. Immune system. Stress is not only emotional tension, it is also a biological response of the body that directly affects the immune system. When the body comes into contact with viruses or bacteria, the immune system initiates a defense response. It releases special chemical substances designed to neutralize the threat. This process is known as the inflammatory response, a natural and beneficial mechanism that supports health. Under normal conditions, once the pathogen is eliminated, the inflammation subsides. However, in a situation of chronic stress, the body stops responding properly, and inflammation persists. This in turn increases susceptibility to illnesses, colds, or the flu, and even allergies or asthma. Long-term stress leads to significant disruptions in the functioning of the immune system. Here are the most common changes and problems that may occur. Increased susceptibility to viral and bacterial infections, which raises the risk of illness, including more frequent colds, flu, and other viral infections. Inhibition of antibody production, which is essential for neutralizing viruses and bacteria. Impaired function of cells called natural killer cells, which play a key role in eliminating infected cells. A decrease in the number and activity of lymphocytes, which worsens the body's ability to fight pathogens and weakens our protective shield against diseases. Slower wound healing, delaying the tissue regeneration process and prolonging recovery after infections. Chronic stress can also exacerbate autoimmune diseases, where the immune system mistakenly attacks the body's own cells and tissues. These include Hashimoto's disease, psoriasis, Crohn's disease, and ulcerative colitis. Brain and nervous system. Prolonged stress can disrupt the proper functioning of the brain. It can affect the body in the following ways. It reduces the volume of the hippocampus, which worsens memory and learning ability. It weakens the prefrontal cortex, which is responsible for logical thinking and emotion regulation, making it harder to calm down using logical reasoning. It intensifies the activity of the amygdala, the area responsible for fear and anxiety. This leads to excessive emotional reactions, such as anxiety and irritability, impulsiveness, or outbursts of anger. As a result, the brain loses plasticity, meaning its ability to adapt and regenerate. Chronic tension and anxiety. Chronic stress can continuously activate the nervous system, leading to excessive alertness, anxiety, and muscle tension. A person under such stress often feels constant agitation, difficulty relaxing, and a sense of threat, even if the real danger has already passed. Mood disorders and irritability. These primarily include mood swings, irritability, outbursts of anger, and excessive emotionality. Chronic stress disrupts the balance of serotonin and dopamine in the brain, which can lead to the development of mood disorders such as depression and anxiety disorders. People experiencing chronic stress are more likely to have difficulties feeling joy and a sense of self-worth. Concentration and attention disorders. Stress negatively affects cognitive functions, especially the ability to concentrate and focus attention. Under stress, the brain has difficulty processing information, which makes it harder to perform tasks that require focus and working memory. Memory disorders. Cortisol, the stress hormone, affects the hippocampus, the area of the brain responsible for memory and learning. Chronically elevated cortisol levels can lead to weakened short-term memory and difficulty retaining new information. Sleep problems. Stress often disrupts sleep patterns, causing difficulty falling asleep. Persistently high evening cortisol levels lead to trouble falling asleep, frequent nighttime awakenings, or poor quality sleep. Insufficient sleep deepens feelings of fatigue and reduces the ability to cope with stress, creating a vicious cycle. Reduced mental resilience. Stress weakens the ability to adapt to difficult situations and cope with everyday problems. A stressed person gives up more easily, has lower motivation, and reduced resilience to future challenges. Digestive system. Stress can disrupt the normal functioning of the digestive system, causing problems such as heartburn, indigestion, stomach pain, or bloating. This happens because cortisol and other stress hormones affect stomach acid production and intestinal motility. Irritable bowel syndrome, IBS. Chronic stress is one of the factors that worsens the symptoms of irritable bowel syndrome, a condition characterized by abdominal pain, diarrhea or constipation, and a feeling of discomfort in the abdominal area. Changes in gut microbiota. Stress can lead to an imbalance in the gut microbiota, which affects immunity, impairs digestion, and increases the risk of infections. Appetite disorders. In some people, stress causes a loss of appetite, while in others, excessive eating, which can lead to weight and metabolism problems. Eating disorders and addictions. Stress can lead to increased use of alcohol, nicotine, or sedatives. Overeating and so-called emotional eating or restrictive eating, such as counting every calorie, severely limiting portion sizes, or eliminating many foods. As you can see, stress is not just a feeling of anxiety or tension. It is a real force that, over time, can damage our physical, mental, and emotional health. From sleep problems and headaches to weakened immunity, heart disease, or depression, the effects of stress are serious and should not be ignored. But remember, the fact that stress exists doesn't mean we're powerless against it. Awareness is the first step. There are many effective techniques for reducing stress, but I'll talk about those in the next video.